Good evening. I want to take a moment to introduce myself. My name is Audra Thomas, and for those of you who don't know me, I am one of the assistant principals at the James M. Quinn Elementary School. I want to thank Dr. Gifford, Mr. Kiley, and the members of the school committee for allowing me the opportunity to discuss the wellness policy here in Dartmouth. So to start, what is wellness? Well, according to the Department of Public Health, wellness means a process by which individuals move toward optimal physical and mental health, regardless of current status or disability, by practicing healthy choices within an enabling environment which encourages healthy decision-making. So when we think of Dartmouth, the individuals we are thinking about are all students and staff in our district. And I'm emphasizing the word all because we are including everyone in an enabling environment, which are our schools. Well, first and foremost, the idea of wellness is not new, especially in the wake of the recent COVID-19 pandemic. We have all seen how important it is to ensure not only the physical wellness of our students being taken care of, but also the social emotional well-being of every student and staff member. Back in 2004, which, if we can believe it, was almost 20 years ago, the Child Nutrition Program for Women, Infants, and Children Reauthorization Act was enacted. As a result of this act, we were required to establish a school wellness policy. Now, we did that back in June of 2015. In 2010, President Obama had enacted the Healthy Hunger-Free Kids Act. So the idea that not only are students having access to food that is nutritious and healthy, but also how that goes hand in hand with the social emotional well-being of our students. So in front of us right now is the Dartmouth School Committee Wellness Policy. It was adopted on June 8th, 2015. A committee was put together, I believe it was called the Healthy Dartmouth Committee, to do this important work. So now it's 2022, and we have just been through a life-changing pandemic for not only our staff, but for our students. At this time, I see a couple of problems that need to be addressed. The first is that the wellness policy is not easy to find. And when asking staff members specifically about this policy, many do not even know it exists. The second problem is that it hasn't been updated since its inception in 2015. As we can all attest, I'm sure, things have changed since then. So when we're looking at the unique needs of our students, we're looking at their physical needs, including allergies, which is something we're going to discuss. We're looking at the social emotional supports that we give our children, and we're also looking at their academic needs. So according to the Centers for Disease Control and Prevention, about 95% of the nation's children and adolescents are enrolled in our schools. And they typically, as we all know, spend about 6 hours a day for up to 13 years in our schools. So, of course, schools have been identified as some of the most effective settings in the community to address preventable health problems, such as obesity, but also not even looking at the physical concerns of students, but social emotional supports, academic needs of students who have been possibly homeschooled or who have been learning remotely due to the pandemic. So, of course, that's something that we need to address as well. And students with allergies is increasing. So these unique needs are the ones that our schools can absolutely support and do support. When we're looking at allergies, this is a safety concern. Students' allergies have increased. The CDC states that food allergies are growing. They're a food and safety public health concern that affect an estimated 8% of children in the United States. That's 1 in 13 children or 2 students per classroom. Currently at the school that I work at, the James M. Quinn Elementary School, we have 29 students that have allergies and require EpiPens if needed. Nowhere in Dartmouth, even with all of our schools, nowhere does it talk about or mention student allergies, or at least a guideline stating that students and staff should not share food within the school to ensure student safety. So there are three alternatives that I would like to run by the school committee this evening in hopes of coming to a consensus on one of them. The first alternative, as you can see here, is that all schools in the Dartmouth Public School District are required to follow the district wellness policy, and a committee is to be reestablished with all stakeholders to update this policy. The district will require annual trainings to ensure all staff understand health protocols and expectations. The second alternative is that each school will create their own school-based wellness committee and wellness policy specific to the needs of their individual school. And the third alternative is that the policy stays as is, with a district wellness policy already developed, yet not being followed consistently across all of our schools. So how are we going to measure the impact of the three alternatives that I just stated? For all three alternatives, it would be impactful to see if districts that follow their specific wellness policies see an increase in school-related physical activities. This data could be gathered through the Youth Risk Factor Behavior Surveillance System, which is a mouthful, or YRBSS, and the National Health and Nutrition Examination Survey, or NHANES. The YRBSS is an anonymous survey, and it's also voluntary for those that choose to take it. Questions on this survey can range from physical, so their height and weight of students, safety, do students drive with their safety belt on, do they text and drive, violence behavior, so do they, have they ever brought a weapon to school, have they ever had a fight in school? It also touches upon bullying, suicide, eating habits. The National Health and Nutrition Examination Survey is a program of studies designed to assess the health and nutritional status of adults and children in the U.S. So this survey is a little bit more broad, and it combines the physical piece, like physical examinations, and also interviews. As we all, I'm sure, can guess, measuring physical activity is not easy. So let's use the people that work with us. Let's use our nurses. Let's use our phys ed teachers to help with this important work. They can talk about observations of students. They can talk about the physical health of students. And nurses, of course, have that data in the nurse's office. Also, our school outreach workers and our guidance counselors regarding the physical and emotional status of students. Another great piece of data would be looking at caseloads of our guidance counselors and outreach workers to see if they have, in fact, increased, especially during this time, post-pandemic, if you will. So really ensuring that, we have a district wellness policy that we are following and comparing our data that we can gather to schools who follow it consistently. Because just because we have one, it's showing that we don't follow it consistently in our district. So there are many factors to address when we're considering each of these three alternatives. So we have to look at the benefits as well as the trade-offs. So the major benefit for having a district wellness policy that staff are required to follow is that it directly impacts not only the physical but the mental health of individuals, improving the well-being of our students and our staff. The second benefit is that it will create consistency among all of the schools, which is really desperately needed. The second alternative of having schools create their own wellness policy and their own wellness committee is that it benefits each individual school in that the policy is unique to them. All of our schools are very different in the district, so it comes with their own characteristics, including the actual size of the school, the enrollment of students in each school, the number of staff members differ, and students' individual needs as well. And the third alternative that the policy says is that it stays currently. I personally recommend not doing this as it creates an inconsistent message across the district. And so the current policy and protocols are not being followed. producing possible unsafe conditions for students and staff. So based on the three alternatives, the alternative that is being proposed this evening is that all schools in the Dartmouth Public School District are required to follow the district wellness policy after a committee is reestablished. I also feel very strongly that the district will need to require annual trainings to ensure that all staff understand the health protocols and the expectations. In this case, the benefits outweigh the challenges, according to this policy analyst. It would directly impact the mental and physical well-being of individuals and would positively impact the staff and students in each of our schools. So as a district, we all want what is best for our students and staff, both mentally and physically. No one is denying that. According to the CDC, researchers have linked healthy eating and physical activity with better academic performance and classroom behavior, such as concentration, attentiveness, and time on task. Eating a healthy breakfast has been associated. We always hear, make sure you eat your breakfast. We talk to students before their MCAS exams and ensure that students are having a nice full breakfast before they come to school, because we want there to be improvements in their mood and memory and academic performance. It also has been linked to fewer absences in school, which is great because students need to be present. The evidence proves that healthy eating and physical activity enhance student achievement and behavior. At this time, Dartmouth Public Schools isn't looking at that data, and so there are no uniform protocols in place. By following a consistent wellness policy, schools in Dartmouth would be able to collect important information about the physical and social emotional needs of their students. This data could be shared at the wellness committee meetings that they would have, and it would provide really great details for the school district and the community. It could lead to more brainstorming between all stakeholders and could enhance current programs that we have, or we could create new programs that could positively impact students' physical and mental health moving forward. That is the recommendation from me to all of you this evening. It really could make the difference of a life and death of an individual when we're talking about those allergies of students in all of our schools. So really having a consistent message and a consistent protocol for all kids. Thank you so much for letting me have some of your time this evening to talk about the wellness policy here in Dartmouth. I appreciate your time, and at this moment, if anyone has any questions for me, I would be happy to answer them. Thank you.